Okay, it's 7 o'clock. We are in session. I see no one from the public, so I doubt there's any public comment. Step one is to approve our October 24th minutes.
I'll move they be approved.
Second.
All in favor? Anyone opposed? Second, we have a consent agenda with a review of home care and hospice. Multiple things are being worked on, and it looks like we should have a follow-up in 3 or 6 months from them on how much progress they've made. So we need to approve that consent agenda.
Move approval.
Second.
Michael, you want to say something?
Can I make a quick comment? I wanted to find it real fast. That was a very exhaustive report. I actually skimmed through it, and there were two things that jumped out at me. One was the metrics. There were some histograms and the metrics of everything that they measured. And in every instance except one, our hospice exceeded state and national levels. Was quite impressive. One was a top. It was quite impressive. The other one, and I'm trying to find it, and maybe I'll have to come back to it, but it had to do, it was right at the very beginning. And the note was that the hospice was looking at a way to provide some grief counseling when
Newborn.
also infant life, and that nothing exists in the community to support the parents who have just lost a child. And it just struck me as I couldn't believe that there was not such a thing. And now we're doing what we should do, looking for opportunities to provide services to the community. I don't know how we're going to do it or how we're going to find money to do it, but I hope that that initiative progresses.
Okay, vote.
Aye.
Anyone opposed? John, I would suggest we send them a note complimenting them on all their good work and then ask for progress in 6 months.
Fair enough. I'll have an update for you too on home care and hospice in a minute.
You're up.
All right. While I'm there, I'll touch on it in the middle of my report, but the Commission on Accreditation or CAP, they're the home health, they're the accreditation partner. I'll get the acronym right someday. Anyway, CHAP was here to inspect and review our home health and home hospice program. And they left our campus and left that review with 0 conditional findings and only 6 minor findings that are really recommendations for improvement. So just to continue the kudos to home health and home hospice, that was a very good visit from CHAP 2 weeks ago. Administrative update. We're just continuing to sit in limbo here as the lame duck session continues. There was a fly-in this week, the 3rd and the 4th, to Washington, D.C. on behalf of the National Association of Community Health Centers. And so we have some partners up there who are advocating on our behalf for a funding package to get passed in Congress by the end of this session so that we can ensure continued funding for community health centers and that part of the organization. We're continuing to await the formation of our new federal and state administrations, understanding who leadership is going to be now within the state of Montana, both the governor, the House, and the Senate. And then awaiting to see what happens and how the appointments shake out for Health and Human Services, CMS, and other federal agencies that play into our So as we continue to wait to see what happens next year with the new administration, we are having several sessions here locally and across the state. Billings Chamber of Commerce just had their recent chamber legislative reception on the 4th, tomorrow morning. We will be hosting the Alliance for a Healthy Montana. That is a public health consortium, the Montana Primary Care Association, Confluence Public Health, Behavioral Health Alliance, the Montana Medical Association, and several other groups. That'll bring together some legislators. I think we have 2 or 3 RSVPs, legislators who will be able to attend tomorrow morning breakfast. And there are also some conflicting, there's an 872 commission tomorrow up in Helena. And so we'll try to get some attendance for that tomorrow morning. But the most important one is December 18th. Our own healthcare alliance, the 2 hospitals, Intermountain, Billings Clinic, and ourselves at RiverStone Health, we will be hosting a legislative reception at 5:30 p.m. for all newly elected and continuing legislators on December 18th. So that dinner will be held at Billings Clinic, their turn to host. St. John's is also a partner in that, helping us pull this together. And so if you know any of your local elected legislative leaders, please do me a favor, reach out to them after this meeting later this week. And I'm happy to share the invitation to the Board of Health so that you have it in front of you. But please invite them to attend on the 18th so that we can ensure we have a really good opportunity to speak to them, educate them about the issues that are going to face our healthcare institutions, and in turn impact the economy, the livelihood, the life, health, and safety of us in Yellowstone County and across the state.
Can you do a favor?
Yeah.
Could you maybe on the 12th or the 13th sort of send out to the board what legislators are attending that you've got on, and then a personal phone call, if whatever legislature you know or legislators that you know, is to ask them to come and remind them of it.
Yeah.
I think we'll garner better attendance, but if you do it now, don't forget, 2 weeks away, don't forget. So sometime around the 12th or the 13th, or even that Monday, the 16th, to make the phone call seems to work of what I've done in the past.
Correct. Yeah, I will do that. We'll send out a reminder. We'll get the information to the board, and that'll allow you both, all of you, to reach out to those you know. Great. A couple legislative days coming up. January the 15th to the 17th. I'll be up in Helena for the Hospital Association's Winter CEO meeting, legislative days. And then in February, the 3rd to the 9th, I'll be out in DC, up on the Hill, meeting with our new delegation in Washington, DC. We do have, we've already sat down and had conversations with Senator Daines and his staff. We have a meeting on the calendar to Senator Tester and wish him well as he departs. And then we have a meeting on the calendar already to meet with Senator Sheehy, Senator-elect Sheehy, and his team before he heads off to Washington. So we've got a couple of good meet and greets scheduled so that we can have those conversations. And then we'll be able to follow up in DC in February.
What about Downey?
And we're working on Downey. Yep. So we're working on the rest. The March 5th and 6th then is the Montana Care Association's P&I, which will be up in Helena. It'll be up there with our fellow community health centers. Coming up next week, it's here already. We're having the grand opening celebration for our senior high school clinic. We've already seen numerous patients since November 4th when they had a soft opening. And they've been able to meet the needs of many kids already in senior high. And so we'll be having a formal event with press, school board, school leadership, and ourselves You are all cordially invited to come see the new senior high school clinic. So we'll be opening that on December 10th at 4. Continue to outreach to Medicaid patients, and you can see the graph below on the following page. Over time, we've continued to see that 10% drop in Medicaid from about 48, 49%, all the way down to 31, 32%. And over that same period, we have enrolled individuals into marketplace insurance plans. So we've bumped our marketplace insurance coverages up from 21% to just about 30%. And we saw a 5% increase over that time in our self-pay patients. Medicare has stabilized, returned to normal, giving us about 22% of our patient population. You can also see there the applicants versus enrollees from the DPHHS data. Again, that we had that high enrollment number hit in November as a result of the redetermination. Over 9,300 applications were put into DPHHS, and we're just now seeing a slight uptick in approvals in August and the fall of 2024 as a result of that big, huge influx of applications. So the data is telling us that there are still folks out there who need their Medicaid coverage and qualify for Medicaid coverage. And so the message to our legislators, the message to DPHHS is that we agree. We don't want anybody on the Medicaid rolls that shouldn't be on the Medicaid rolls. But the folks that qualify for Medicaid and need it for their healthcare needs ought to be on Medicaid and get their applications processed. We had our Tree of Lights ceremony on November 13th. Our home health and hospice program, along with the foundation, lit our tree. And we had almost 100 staff and family members, much larger much larger attendance than we thought we would have. It was the largest attendance we've had since we had gone virtual during the COVID years. So it was really great to see that come back, community come back and watch the tree be lit and provide some money so that we can provide home care and hospice services. November was also National Home Health and Hospice Month. So in order to celebrate, CHAP came by. And so our community health accreditation partner, CHAP, came by for their unannounced inspection. And like I said, we had only a few finding suggestions, but no conditional findings that would put our accreditation in jeopardy. Kudos to the home health and hospice team. We also had a chance to be highlighted by the Geiger-Gibson program at the George Washington University. They highlighted our 40th and 50th anniversaries in their Chronicles of Community Health monthly newsletter. For those of you who don't know, Dr. Jack Geiger and Dr. Count Dylan Gibson were the founders of the Community Health Center movement in both Boston and in Mississippi. Those two gentlemen formed the very first two community health centers in our nation. And so that program, GW, is very front and center on the community health center movement. Going down to protection and access, I know we talked about it, but our lab has continued to expand hours, and we've seen nothing but positive patient feedback and results as our lab is now more readily available for patients.
John, is that costing us money?
It is costing us money, but it is also returning.
Well, I was thinking, are we getting more back?
But we're getting folks into the lab and meeting our patients where they need us to be. And then finally, I'll give you a little public health update. Flu continues to be low. Fortunately, For the week ending 11/16, only 131 cases season to date. That has continued to stay low, but the surge is coming. Typically late December and January. And so if you have not received your flu shot yet, I'd suggest you do so, because we're probably only a few weeks out from any big surge in influenza. COVID-19 continues to also stay low in the community. We have seen a little bit of an uptick in confirmed cases, increase in just about 900 from the last month across the state. And only about 7% of those individuals were hospitalized, with only 64 reported deaths. We do, and many of you might have seen the press release this week on pertussis. Dr. Littlefield, do you want to say anything on pertussis?
I mean, cases are still elevated. We've had some more cases in Yellowstone County. We talked to both Color 8 and NPR, and I think they ran both of those in the last couple of days. And we sent out another reminder to medical providers about when to test for it. It's challenging because initially it really looks like all other URI symptoms that we're sort of seeing circulating, and we expect that there's a lot more cases out there than we've actually identified. I think we've had 11 confirmed in Yellowstone County, but for each of the 11, there are 4 cases that are probable cases that have been associated with it. So people who are close contacts with symptoms who get treated and are assumed to have pertussis, even though we don't run the test for it. So there really has been more than 11. This is following the nationwide trend that we're seeing with an increase in pertussis. And so get vaccinated, continue to encourage vaccination. And if you know of anyone who has is having coughing fits or a prolonged cough, tell them to go see their provider with a mask and get tested.
Thank you.
How many of the people, and probably a small group of the 11, have or have not been vaccinated?
So with pertussis, there's a lot of conversation right now at the national level about how vaccination rates have declined. And so I was reading American Academy of Pediatrics article just the other day, and pre-pandemic nationwide vaccination rate was sort of up around 98%. And it has kind of ticked down, and is now, I think the last measure was like 94.5%. So it has ticked down. The uptake of the pertussis vaccine is still fairly high. Most of the people that we're seeing with pertussis have been vaccinated. And so, pertussis is most dangerous to infants under 6 months. That's where, when you hear historically about whooping cough and, children so 1 in 3 infants who get pertussis end up being hospitalized with pretty serious illness. And so, the goal is really to protect that population. People who've been vaccinated get sick. It's the other name for pertussis is the 100-day cough. It often is a cough that lasts for a really long time. And so it's annoying, but it's not as dangerous to older people. Vaccination wanes around 4 years after you get a booster. And so even though, we have a lot of people who are vaccinated and are somewhat protected against it, that's one of the reasons why it circulates fairly regularly.
Thank you.
All right. And then we're continuing to monitor not only pertussis, but whether it is E. coli or salmonella, cucumbers and other things that are out there that you may have heard of. Our environmental health staff are on it, and will continue to provide any necessary updates out to the community. So your Big Macs and quarter pounders are safe again. This time. So,
From a salmonella standpoint.
from the salmonella standpoint, yeah. From the general well-being. Pleasure. Conversation.
Ian,
I have a question. So I'm sure that I have not a pertussis booster or ever. Is that, it's never talked about when I go see my doctor. Is that?
Yeah.
Typically, you get that as part of the tetanus booster, with the DTP or you may have had it. You can get a tetanus shot.
But if I haven't had a tetanus shot for,
You probably
Tell us
should.
why.
Then you're at,
Yeah.
then I
you
should.
say SOL.
That's good.
What they've said previously, and I think the guidance is changing a little bit. Previously, what they have, so there's the 5 vaccines that you get in early childhood. You get an additional vaccine in middle school. And then one of the most important vaccination opportunities is with every pregnancy. And so with every pregnancy, it's recommended that women get revaccinated, even if their pregnancies are close together, mainly because then they're producing antibodies that carry over into the newborn infant when they're most at risk before they're able to start their vaccination series, which is at 2 months. And then we have historically said at least one of the Tdap as an adult, and not necessarily every 10 years. It's true, Lionel's correct that most of the time when you get a tetanus, you're getting a Tdap and not just a TD, which is the tetanus, but not all the time. So it's probably a good idea. They're now really moving more. Of the recommendations now are really saying every 10 years we should be recommending revaccination in adults. But we're not very good at getting adults vaccinated every 10 years for tetanus either. So.
Thank you.
all right, you're up.
Just one other quick question. We've talked a lot about, I know you and Shannon and I have, about person qualification, the number of people in their lives who've got Medicaid eligibility. Do we know among our covered lives, when we measure that, do we know how many of those are coming from the school clinics that we operate? Yep.
Yeah, yes. The short answer is yes.
Are they material? Is that a big number?
Is it a big number in the school?
Is it 10% of the covered lives? Is it?
I mean, the school clinics, while Eric's getting that information, the school clinics are still fairly small clinics. So we're seeing we're seeing a low volume of patients there compared to the main clinic. We run those clinics not full time, and with one provider there. So I think that if you look at our overall attributed lives, it's going to be fairly small. However, most children, and even if expanded Medicaid goes away, which we all hope that it doesn't because of all of the impacts that it will have, children are still generally covered by Medicaid. And so if you look at our percentage of uninsured people that we're seeing at the school clinics, I would say that's very, very low, because there are very few children who are uninsured. The only kids that are uninsured are parents who are over income for Medicaid or any of the Medicaid, Healthy Montana Kids, any of the Medicaid children products, and who don't get insurance through their, so they're largely, when I see them, it's largely self-employed people who are over income, so they don't qualify for, any of the Medicaid services, but they either don't make enough, or they or they're not able to buy sort of private insurance.
So really, the bulk of the people going through the school clinics are going to be
Insured,
beneficiaries.
absolutely.
Okay,
All,
thanks.
our entire and so that's one of the reasons why, you know, we have some other pediatric specialty focused clinics, and we've expanded our number of pediatric counselors, providers who tend to see a lot of patients. Most of them all have Medicaid. So it's a sort of a safe place to be involved from a financial standpoint.
That makes sense. Good.
Sorry, Eric, I don't know if you have the actual numbers, but.
Any other questions
Are
for
we ahead
John?
of schedule? Are we ahead of schedule?
Slightly. Go ahead.
Then I'll be quick.
Unusual.
Well, maybe I won't. Every year for 25 years in microbiology laboratories at several different levels, 2 or 3 times a year, we investigated deli foods and meats and items from the local grocery stores. In every instance, we isolated E. coli from hamburger. In every instance, and 2 or 3 times we isolated the E. coli 0157, the serious strain of that. So I was quick, but I have to continue. Don't eat your hamburgers medium rare. Cook them. I'm sorry for being, I'm done.
I was gonna ask that question, so save the question.
Okay. Any other questions for John?
No, not well.
Not well.
Okay, Megan, you're up.
All right, so my reports in the report, I guess, my reports in the report. We're continuing recruitment. We unfortunately had another physician assistant who's leaving in December. And as I think I mentioned before, we had one who left in October. We had one that went down to part-time. We've opened an additional site. And so we sort of are pulling, you know, our APP staff in a lot of different directions, which has decreased some of the access here in clinic. We do have 2 candidates who we are interested in hiring. They're both new grads. And so again, we've had conversations about how what we really want to start here is a formalized APP residency program. Because it really is a lot of work to take a new grad mid-level provider who often, you know, our APP providers are fantastic providers. We get them trained up. They provide excellent care to our patients. They know the limits of what they're able to do. They're working in a very supportive environment where there's lots of backup here when they have questions. But when they come out of school, they have had very little training. They have had less than half the training that our residents have when they start their residency. And during residency, for that first year of residency, a resident barely says the word boo without an attending physician behind them. And so, so having a residency program here would not only benefit our APPs and have the what we do in place in a more structured format, but it also, I personally, there's been lots of talk going into the future about how one of the solutions for expanding the healthcare system is really increasing, allowing APPs to have more reign in what they're able to do. We could talk about that, for hours. That is a dangerous thing to do with a new graduate. And without having a residency program. So I think what a residency program here would do would not only help us, but it would also help what's getting put out into some of those smaller county communities where they can't recruit a physician to go out there. And so, the only provider that you have in some of the counties in Montana is a nurse practitioner or a PA. And, so we just need to make sure that they are really well trained.
So how many residencies are there?
in the country. I don't know the answer to that. So with APP residencies, so there are nurse practitioner residencies, and then there are PA residencies, and then there are sort of this growing number of APP residencies, which train both nurse practitioners and and PAs, and that's kind of a new concept because the PA lobbyists and the NP lobbyists have historically been very almost at odds with each other in many ways. And so I think they're just starting to come around to this concept of, let's have an APP residency, which can train either one of those. And a lot of the training programs are not accredited. So, so there's not the same accreditation process that there is for medical residencies. I think some of that infrastructure is growing. So I don't know the exact number of accredited versus unaccredited. What we really need here, we have all the elements here. We really are trying to find a way. We need an administrator who is able to, kind of process applications, work on schedules. It's probably like a 0.5 FTE position that would support the infrastructure of a residency here. We've applied for several grants and have not gotten them to do this, and so we're continuing to try and find other creative ways to do that. But we will probably take these next two grads that are early grads, if they agree to come here, and sort of put them through what we kind of have been doing as our informal residency program, and hopefully we can get that formalized in the next year or two.
You mentioned grants. How big of an expense would it be to establish a?
Do you remember when we applied for?
We're getting a business plan
Yeah.
from those who are working on this, and that'll be something that we bring.
Yeah, that we
have a
can bring
conversation.
here.
Yeah.
Would this be something that would benefit both the places up the hill?
Yes.
Absolutely.
And so that we become sort of we became the main person of it, but we incorporate the other two. So
Well, in reality, that's what happened. So Casey, who our Cami, our PA, who is leaving Warden, she's going to take a job as a primary care APP at one of the places up the street. We've a number of and that's what happens is they come here, they get a fantastic, because a lot of other places won't take new grads because they just don't have the time to train them. And so they come here, they get a fantastic education, they get well-rounded in all general medicine, and then they leave to go up the street to get paid, quite honestly, to get paid a higher salary, because our salaries are not competitive with the places up the street. Our other Julia, who's leaving, she's leaving to go to Denver. So that's not, but she was here for a year and was then able to get a job in Denver because she now has, this great, baseline training.
So if we provide the people for the people up the street, do they support us?
Why no? But that is a great idea.
No, I mean, really.
No, I mean, realistically. And I mean, we even have, we're using our PAs on our hospitalist team too, right? So we have, the PAs, when they come here, we have the opportunity, we have the formalized didactics that we do with the residents already that are every week. We, for the first 6 months to a year, we actually dedicate time for our new grads our new PAs to be able to come and participate in our resident didactics. So we already have a didactic, structure in place. And then we really can rotate. We really could rotate them through a variety of outpatient, environments, more rural, at our rural sites, our school-based clinics, healthcare for the homeless. We do a lot of addiction medicine. So all of our PAs get trained in how to do opioid medication assisted treatment. And then we have the inpatient experience that we could rotate them through. So we really are, what we need is dedicated time. So what we would need is to have an administrator and then dedicated time for other PAs, other APPs to be preceptors. Because right now we have our residency preceptors and they do go and ask questions when they really need it at the residency. We have a long onboarding process where they're working side by side with a experienced provider. But then after that, what we really need is a dedicated preceptor who, when they're seeing, so with our residents, for every 4 residents that we have in clinic, we have 1 faculty member who is there precepting them. Their whole job is to back up those residents that are seeing patients. And so that's the structure that we would have to, and of course that pulls, a provider off of seeing patients so that they can support, some, 4 other people who are seeing patients. But anyway, we'll work on that business plan and bring it back to you. And I think talking to the folks up the street is a great idea. We tried with MPCA, we really tried. Our first approach was to try and get health centers across the state to all kind of come together. And that did not come to fruition for a whole host of reasons. Largely because they were worried that what would happen is that these rural sites would have providers come here and get trained here, and then they wouldn't necessarily want to go back to these rural CHCs where they get underpaid when they can go work up the street and get paid a lot more money. And so they were not, so One Health was not really excited about, supporting our residency, but the hospitals might. All right, enough of that. Let me move on. I could talk about that for a while. We talked about the school-based health center. Joliet is now up and running. We're seeing patients there. We've had ongoing talks about trying to increase patient access and encounters. We did increase the number of patients that residents could see. Interestingly, one of the things that we did do last week was we had a provider listening session. And Eric and myself went and invited all of the providers to come and sort of give us feedback on how things are going. And there was a lot of expressed concern about just staffing support and the amount of tasks that our medical providers or our providers are doing that are not really medical provider tasks. And some of that has happened. There's been a big sort of creep backwards in that with some of the positions that we had to eliminate. And some of the things that those positions were doing have now fallen back onto the medical providers' plate. So I think it really is a priority for us to figure out how to solve that going forward. One of the solutions to that, so part of that is looking at not just how many more people do we need to hire, but how do we do things more efficiently, and how do we leverage IT and different solutions to make the human work less heavy. And one of the things that I personally am really excited about is we've found Freed is an AI scribe, basically, that helps providers to write their notes. It does not have AI decision making built into it yet. Some of the scribes have that. This is pure sort of scribing, but we've had a number of providers try it, and we're really excited to roll that out hopefully in the next week or 2.
Yeah, as soon as they get their money, they can stamp those
Awesome.
licenses up very quickly.
Awesome. So we're very excited about that because charting after hours is a big negative feedback from our providers. The other thing that we've seen, just one other thing from the clinic standpoint, the other thing that we have sort of seen slip also, I think largely because of our staffing issues that we've had, is some of our value-based care and our shared savings plans with Medicare. So for example, for Medicare, one of the benchmarks that our goal is to hit, and this is with all of the CHCs, so it's not just falling on us, is the Medicare wellness visits, which previously we were doing a reasonable job at hitting our own personal target. That has dropped. We're one of the worst in the state this year. And that has really dropped down to a very low number. And part of that is because those Medicare wellness visits require a lot of non-physician time to get those done. Those are largely medical assistant driven history taking. And we just haven't had the staff to be able to dedicate people to do that. So we do have a few, both Dr. Baumert and myself during Christmas week have opened up some additional sessions to try and get some of those Medicare visits done, in under the deadline of December 31st. So we'll see how that goes. I think that's pretty much what everything else is in there. We talked about pertussis. Anyone have any other questions? Next time I'll focus more on public health.
Just a couple clarifying points. The things that Megan stated, the 2025 and here at the end of the year, we are going to be re-engaging in a pay analysis so that we can continue to set some goals and close that gap and make sure that we're on the right percentile in terms of pay and competitiveness. And we've got the contract signed not only for free, but we now have also another AI contract signed for a tool called Droidal, which is going to help work through some automation of Medicaid applications and checking Medicaid eligibility. So we're trying to use technology to our advantage. And then the residency fellowship NPPA conversation, there are around 80 out there nationally. Some of those are accredited, some of those are not, but the majority of those are in specialty care and not in family medicine and where we want them to be. So it'll be something part of the few and the proud if we're able to pull it off.
You're good. Jim, educate us.
All right. A lot of stuff to cover today. Busy agenda. Michael put us behind again.
Sorry, it's me. I can't let Michael take.
So far,
Oh, you can, trust me, you can.
I'm okay. All right. September's a good month. Let me go through some things quickly. First, I want to look at the income statement. So second page of your report. And I would say the comfort on the committee in going through these statements this year is a lot better than it was last year. We have a lot of confidence in the preparation. Everybody gets his bean counters for the budgets, but this one does give people in my profession a great deal of comfort. It gives us, from an analytical standpoint, we can look at what the actual numbers are versus the budget and understand the variance. And that gives us a whole lot more comfort in the position, the financial position of this organization. And a number I always look at and have for decades is 2/3 of the way down that page, the net operating revenue. I could talk for too long about the variances above that. When I see for the month, 384,000 to the good against a budget of 113, the brackets around it, that's a darn good month. And that carries through to the year-to-date numbers. Accumulation of 3 months, the first quarter. I'm going to flip to the next page. Because we always talk about cash. Starting at the top and going down to about the first half of the page. For the month, if I add up those first 5 numbers, $5.5 million on a cash basis came into RiverStone in that 30-day window from those 5 different sources. Then when we turned on the computer and printed checks, $4,364,000 went out the door in those three different categories. We sent out 4.3 net. We put almost $1.2 million into the bank account. That's a darn good month. That will not happen every month. There's a lot of volatility. You start looking at a core-based books, and when you time out the payroll payments, the payroll is over $1 million every 2 weeks. So there's a lot of variability in when those disbursements are made. But nonetheless, after 90 days, that's a darn good report. So we drop down cash at the end of the period is $8,994,000. And I flip to the first page. And in the first column on the first page, the third number is 8,994. It's tying back to the cash on this statement. We have talked about critical performance indicators or something. KPIs, thanks. Finance committee would probably recommend not this chart, but the chart behind it that is in your package. The bean counters are wringing their hands in May and June for the end of the fiscal year. This is what we wring our hands about. These are the components of cash in RiverStone, in the obligated group. Remember when I talk about my marriage to you, Darlene is YHP and Jim is RiverStone. And when we go sign on the dotted line, both of us, when we take out a mortgage to buy a house, we are jointly and severally obligated to pay that off. So everything that Jim has and everything that Darlene has is obligated to that one debt instrument. YHP is created to do, in my opinion, to do financing. It's a 501c3, so it issues tax exempt debt and it holds the real estate. Right? The two of those in combination as RiverStone Health, Yellowstone City County Health Department, DBA, RiverStone Health. That is the obligated group. That is my marriage, right? That's the analogy. And this is the cash on the books that we report once a year to the bond insurer. There's a stipulation in the bond that says you won't let days cash on hand go below this number. These are all the components. If I go over to the right, when I harp on the COVID money that's coming in, that is the olive that in the far right-hand column is 2.6 million. The COVID money that we have that is about $1.5 million is included in that number. It is eliminated from the days cash on hand calculation in the bond indenture. It's only unrestricted cash that we include. That is restricted. All that 2.6 is restricted. 1.5 is the COVID money. The reddish stuff below that is not restricted. That's the proceeds from hospice home. More about that when I get to YHP. Okay. So these are all the components that the bean counters have been sitting here tumbling in their head as we get close to year end and we're talking about this. We're trying to explain. The next page is what I think would be a very reasonable KPI for the next couple of years. The red wicking line is the unrestricted cash. Days cash on hand. So when we looked at the cash flow and I said, here's the checks we wrote for all these different purposes. That's in a 30-day period. I can calculate per day how much cash is going out, or I can take the 90-day column and calculate how much cash is going out, divide that into my cash balance, have days cash on hand. That is the bond indenture stipulation. And it is represented at 60 days by that heavy dotted black line. Okay? This is what I think a reasonable KPI would be for the organization. Don't want to vote, don't want your acceptance. I'm just in sales mode right now. But you get out there to September, it's 73 days. See a lot of quizzical looks, I'm baffled, you sorry.
It looks like when we were at 29, we were kind of, we were in danger.
Lionel, speak up.
I said.
Those of us in the back can't hear you.
Back in March, when we were at 29, we were, it was a precarious position to be in.
There was anxiety. So when I come in here and I say that we are not a wealthy institution, we need to preserve cash, we need to be responsible in our behavior, how we use cash. That's one of the driving factors why I would say that. We are nowhere close to where we were pre-pandemic. We weren't wealthy pre-pandemic. We're a whole lot less wealthy post-pandemic. Okay. So yeah, we still need to build.
Same thing, Michael.
So the majority of the change in cash since June has been the money we got for the hospice house.
I would say operations, Carol, and I haven't gone back to
Okay.
measure.
I'm looking at July of last
You're
year.
looking at the bar chart.
I'm looking at the bar chart, yeah.
Yeah, okay.
Yeah, so from July to July, the difference is
Yep.
about, yeah.
From June to September. Yeah,
Yeah,
May to
okay,
June.
okay.
That bump.
Yeah.
Yep.
Money from the house here is mentioned quasi restricted.
It's,
And,
it's,
yeah,
yeah.
in other places marked in dedicated fund. I think somewhere.
Yeah, we don't have technical restriction on the hospice home money, but it is currently at YHP.
Why do we keep that?
I don't know why it's there, but that's where we put it when we sold it. You know, we got the cash June 30, I think.
The house was held in YHP, so when it was sold, it was transferred into the YHP accounts, and we set up a separate designated account just to make sure that that was delineated and separated for ongoing use in the future.
How long will that be a separate fund?
YHP discussed that.
Oh,
We'll talk about it in about 30 minutes. If Michael lets us get there in 30 minutes, we'll talk about it.
And there's some discussion at the foundation because it was, a lot of that money was raised through donations.
Right.
And so, you know, it gets a little complicated.
Yeah, I understand.
Any other questions? Any other questions for me about all that I've said? I think it was Monday. It's been a busy week, a lot of meetings. I think Monday, the Joint Finance Committee met, which is Board Finance Committee and the CHC Finance Committee. Steve, the audit. We don't have the typo-free report to offer you today. And it was received with an unqualified opinion. Kudos to the staff. I do respect how challenging it is to get through a fiscal year for a healthcare organization and present numbers to its board, to its finance committee and its board that come through the scrutiny of an audit without adjustment. I'm happy and proud of the staff. Happy for the staff and proud of what they do here. What you saw June 30 and the RiverStone Health in the combined statements, YHP plus RiverStone stood up to the scrutiny of an audit and were unadjusted. The report will be forthcoming to anyone who hasn't signed it. And the MD&A is a very good read. That's it, Coach.
Nicely done. Any questions for Jim?
I'd like to just make one comment. the last time we had the audit, when's it completed by? So we've been, it really, they got it done a lot faster and it has to do with our staff, the staff getting it done and everything else being clean, so. And that's actually gotten better, I think, the last 2 years or 3 years since. So that's good. It's nice to have that done early rather than later.
Thank you, Shannon. Okay, we need to accept the November 21st minutes from the Finance Committee.
I'll second.
All in favor?
Aye.
Anyone opposed? Next, we need to accept the September RiverStone Health financial statements.
I mean, you said second.
All in favor?
Aye.
Anyone opposed? Okay, we need the September Yellowstone Health Partnership financial statements.
Oh, good.
Oh, good.
I'll second.
Okay. All in favor?
Aye.
Anyone opposed? Good. And then we need to accept the September combined RiverStone Health and YHP statements.
I'll make the motion.
Second.
Okay,
Aye.
all in favor? Aye. You're in. Anyone opposed? Okay, we're done. Lionel, you're up.
Okay, this is the November Safety and Quality Committee minutes meeting. We had presentations on from our epidemiology and epidemic teams, and reviewed what had occurred over the previous few months, having to do with how they responded to incidents, with respect to things like the salmonella foodborne outbreak that was discussed earlier, the cryptosporidium issues with our swimming pools and lake. And really, what I found the most useful thing was the second page, overall lessons learned from the group, which was that they talked about making sure that clearly defined triggers to activate processes go into responding to an epidemic were followed. They talked about lowering the threshold for activation of the EPI team. They talked about defining the role expectations of team members. They talked about that sometimes we have these processes in place, these things that are supposed to be done that aren't always done because people, the policies are up on the shelf and they don't always necessarily remember, yeah, I should have done this. So they talked about ways of maybe improving that. So overall, it was, we talked about how the group is trying to keep us all safe, and I feel safer. Any questions about that?
Okay, Leanne, you're up. Oh, wait, we gotta accept the November meeting notes.
Okay.
We accept.
Second.
All in favor?
Aye.
Anyone opposed? Okay, Leanne.
Okay, there you go. Good. All right, we have met in November. And we actually had a lot of different things that we discussed, and so I'm gonna go over each one of those briefly, and then John may add a few things to what I need to talk about. But the first thing that we talked about, obviously, was the legislative session that's upcoming, and those special priorities that were identified and approved by this board. And I received all of that information in the last board meeting packet, and not in this one. So I would just recommend, or if you would be back at those with the legislative session coming up, and keep those in mind if you're talking to someone who represents you at the legislature. Let's see. One of the things that is in your packet is this list of all of the people in Yellowstone County that were elected to represent Yellowstone County. So again, kind of look at that, see if there's any of those people that you know. And if there are, please make sure that you let John know that. So that if he has something that's going on, he can get a hold of you to contact your representative.
And is, I think Kelker is stepping down, is that right?
Yes, she did. And so,
And my carpenter.
She's already actually, we approved her on
Yeah.
Tuesday, so now we have to replace Emma.
Have those
Yeah,
already
they
come
have.
forward yet?
No, they haven't. I would imagine they're gonna have this pretty quick.
Yeah.
Try to get her, the next person on board before the election.
right.
There we go.
We were moving around enough. Also on that sheet is, on the backside, is the selected Senate and House leadership. So, and keep that in mind. We then talked about AVA and the other one, and oh, it's growing in popularity, and I believe John has sent out a letter to all of the potential people that are distributing or selling kava and reminding them of their obligations as far as how they can sell that product. But is it there? Probably the big thing that we talked about was the grading system for Yellowstone County retail food operators. So there's quite a bit of information in your packet that was presented to us and then discussed. I think one of the important things that you will want to look at is that they're not anticipating doing this in a vacuum at all. That it will be brought to stakeholders to get feedback from them. You know, they'll come up with a proposal and then it'll be brought to the stakeholders and have them say, yes, we like this part, no, we don't like this part, or what do you think you're doing? Or why haven't you done this a long time ago? Whatever they might come up with, but so they'll be working on that first part this winter, and then spring, they'll look at pilot development and recruitment, and then another pilot in the summer, and then the evaluation of that, and then possibly by winter of 2025, so this time next year, do a launch, that whole process. That's in a nutshell. And John or Brent, anybody else have anything they want to, or John, my coach?
No, I think you covered it, Deanne. I think the most important thing for folks to know and understand is that whether it's a grading system for retail food or the conversation we're going to have at the legislature this session on in implementing a new fee structure for environmental health, for licensure and certification, that it's a team process and that we need to engage a restaurant association or chambers or local businesses or retail food establishments across the region, and partner with them to make sure that they're getting what they pay for. I know there are a lot of concerns out there publicly across the restaurant association and other groups that they feel like they're getting shorted and slighted right now because we did not have the manpower to go out and provide that second inspection visit. And cover all of the retail food establishments and places that we provide licensure and certification to across the county. And so we're going to work hard this session with the legislature to create a common sense solution to try to shift the burden of financing those individuals and those inspections from the individual property taxpayer to the organizations that are reaping the benefit, and create safer food establishments, create some common sense goals, and work to create regulations in concert with business so that we can do the right thing. And that's ultimately what it comes down to, is how do we help local business establishments do the right thing, protect the safety and the health of the public that they're there to serve, and provide accommodations to, or provide food and drink to. And we'll do that in the right way together. So this is the first that folks may be hearing about this, but it's not the last time. And we're going to bring folks together around the table to make sure we get it right.
Michael,
I have a question for Steve and Don. Do we expect some lack of support from the food industry? More regulations, more, oh no, something else we have to do?
Not more.
It's really, from a restaurant perspective, you get inspected. So basically, the way I would look at this is they're taking your inspection and they're making it, instead of giving a report for every restaurant, the symbols or whatever numbers or whatever you want to use, letters, are really basically how you've scored on your inspection. And you're showing that to the public. So there's transparency.
Yeah.
So it's not like, I don't see them going in and doing a different inspection for this. I think the area will be always boils down to this, is consistency in the inspection. And how is that? And, and I would probably have a look at certain things that are tangential, that are really not affecting the restaurant, that can get called. How's that rated? Is that a comply versus non-comply versus something, you're storing your food incorrectly? So I think doing this and redoing the inspection would be beneficial. You'll get pushback because people won't, I'm a good operator. I could care less, quite honestly. If I'm down here and the good are okay, yeah, you're going to get pushback because I don't want anybody to know that I'm a crappy operator. That's how I look at it. So to me, that's really it. It's for the benefit of the people.
Which I think Steve summed it up really well. That's, but there are some variables when you have an inspector come in. If they come in and look at I don't have it anymore, but my meat thing, my meats go down a little bit when I have that thing and I'm serving all the time. And so most inspectors are cognizant of that, won't come up right away. When your meat might not meet temperature, but they're going to be up within the time standard that's available to make sure that they meet that temperature. But I think Steve hit it right on. I mean, most of them, but if the inspector doesn't like it, they could cause some havoc for you that really isn't warranted. So there's always that, make sure that, yeah.
Do you think we have that problem in Yellowstone County?
There's no inspectors to the person that's doing the inspection or the person that's getting inspected. And I'll give you a prime example. So we got inspected 2 weeks ago, I think, or a week ago. And downstairs in the bakery where we store our flour, it's on a rack, and that rack sits about that far off the floor. Well, that restaurant's been there as Stella's for 18 years, and we were inspected, and what we were told is that that rack has to be 6 inches off the floor. And so we were cited here and there, and as the person doing the inspection, from what I gathered from my person, was he refused to sign it because he says this has been 18 years that people have been coming, this has been in the same place for 18 years. And you're dinging me for it. I don't mind, and we fixed it, which is no problem, but it's how that's presented. So when I talk about consistency, is that a comply, non-comply? What's the red flag on that? So I think if that's taken into consideration with the restaurants, you'll have a lot of acceptance from that standpoint.
And that's the conversation we need to have.
Yeah.
We all have opportunities for improvement. We're all human. And so how do we come up with the most common sense approach to implementing the food code?
Yeah.
And making sure people are safe?
And that's really it. Yeah, you walk in, just so that you know, I told John that we got at our restaurant this week, and I made the huge mistake. I should have brought sanitation people in to look at it and to see where stuff, they inspect basically what they can see. They're not crawling underneath, and it would have been eye-opening for them to see. I mean, it wasn't bad, but 25 years, it's time to get things done. So
Is the inspection, is it planned or do they just, they don't let you know, they just come by? Hi.
we're here. And they're usually pretty good about it. They don't come at 10 o'clock in the morning for mine or that. I mean,
Yeah.
they're cognizant of when things are going to be done, but they also want to see the operation,
Sure.
in there. And, quite honestly, if they gave us advance notice, everybody would fix most of the
Right,
stuff.
that's right, yeah.
That was wrong. And so I have no problems having it being done when they do it.
Michael,
I think it's a great initiative. It'll take some time to get the community involved, to get everyone involved. I think it's great. In my traveling around the country in places where they do this, whenever a restaurant or food service operation has an excellent or highest rating, they proudly display it up front, and you get to see it, and you have some confidence in their processes. I think it's great.
Yeah, I agree. I think that it is, there's bad actors out there that I think continue to go on that really it should be emphasized that you probably shouldn't be. And you'll hear some of the inspectors that will say, yeah, don't eat there. And it's like, whoa, why isn't that out to the public?
Why do they still get to operate?
Right. And so, but yeah.
Because they serve raw hamburgers. I don't want to make Lionel said you should clarify. Eat your hamburgers, at least medium, that's good. Don't need to toast them till they're crispy, crunchy, black. That's not necessary. Medium is fine. That's sufficient.
That's good.
So it shouldn't be pink then? Is that kind of or is that?
On the end,
Medium would be pink.
On the edge, if you get to that, on the edge, that's enough heat. Medium is okay.
There's somebody in Montana that's doing great.
Yes, there is.
Oh, there is?
Yes.
Where?
The Flathead,
Oh, okay.
Flathead County, Solo.
Those are the ones I know about.
Yeah.
So that's gonna take care of a lot of pushback, because especially those that have multiple restaurants, especially if they're in Missoula or Flathead, they will have already had this. I think, once again, I go consistency. So what are the calls being made in Flathead that are being made in Missoula that are being made here? There's nothing more frustrating as an operator to get a call here that's not called there. And so that consistency would be great.
Yep.
I just wanted to mention that during my time period that I was the director of the Salon and Adult Resource Alliance, having the inspectors come into our kitchens and our meal sites and say, yeah, you guys are doing great, was very reassuring to me. But also we could let the people that were coming in know that, we meet all the standards. And so it's safe for you to come in here.
so we need a motion to accept the November meeting notes.
Second.
All in favor?
Aye.
Anyone opposed? Okay, Jim, you're up on a YHP update.
Thanks, YHP met earlier this week. And I apologize, I asked Carrie to put it on the agenda where it is. I should have asked her to put it right after finance. Don't want to touch on the cash again. We always take great investments. US Bank manages the endowed funds that you would see on the balance sheet if you had those statements. And then go through the income statement and cash flow. Again, YHP is a 501c3 set up to do tax exempt financing to capitalize this operation. So the buildings would help there. And RiverStone rents those buildings from YHP. And then YHP services the debt. So when the hospice home was sold, its cash is there. And it is that last number in current assets. Balance at 9/30 was $1,617,338. And we had a brief discussion about how do we best deploy that money. We are now cash rich. It is in its current location included in the day's cash on hand calculation. It is not restricted, but have to come back to YHP. They would have a recommendation. If it has is, they would recommend changing it. And you might make a little more income off of that, but you still need liquidity. As Lionel pointed out, the day's cash on hand was looking pretty darn grim in May of last year. And as Carol pointed out, the sale of the hospice home is what bumped the cash up. And in compliance with the bond indenture. So we don't want that money to go far, believe me. Want it to be included in that calculation. Any questions about YHP?
Jim, just looking at it, unless we have a burning need, it seems to me that given where we've come this year with the financial and all of Medicaid, Medicare, what's gone on with that is that it would be ideal to try to hold that for this year with the intentions of understanding where are things going to level out. I guess I think they're at the bottom of the trough. The question is, are they? So to me, I guess I would be inclined more to be conservative and hold those funds as much as possible. I understand there may be need to hold those funds.
Have we had any feedback from donors on?
No, I don't know if we have or not, yeah. I would say with the upcoming legislative session and with the changes that will take place at the national level, I think it would be very wise to just do exactly what Steve said, just hold on to it.
Okay.
And to the donor question, we have not had any inquiries specifically to those funds. We've had one or two conversations with specific donors who had items in the home. We made sure that the final disposition of those items got where they wanted them. Some wanted them to stay in that home and with St. John's. Some wanted them to be returned or be placed elsewhere. But that was the majority of the comments. Yeah. The point we're all making is that we're just going to continue to be good stewards of that money, regardless of where it came from.
Okay, the governance committee met this week. We had a lot of meaty discussion. First, though, we need to accept the November meeting notes.
Will we accept those?
Second.
All in favor? Anyone opposed? And then we need to accept the December meeting notes, which you may have gotten.
Move we accept those.
All right. I'll second.
All in favor? Anyone opposed? Okay, at the meeting, our initial discussion was the nominations for officers of the board for this coming year. And we came up with Jim as chair of the board, Steve continuing vice. And Spencer has agreed to step into Secretary of Finance on a 3-month trial basis as he does this on 2 other boards. Now, fortunately, it's finance and this, and the other 2 things you're on only meet once a year. So I think there's hope.
Happy to serve. Hopefully I can fill Jim's shoes on the finance side. I don't have any Darlene.
Change that story.
So do we have any other nominations? Okay, do we move to accept these nominations?
So move.
All in favor? Anyone opposed? Okay, we also reviewed the assessments you all did about yourselves and the functioning of the board. The self-assessments are all pretty standard. One suggestion might be that you could meet with someone on the board whose opinions you value and ask them to evaluate you. Because I think sometimes outside sources see things better than we do ourselves. In general, the assessment of the board, again, pretty positive. There was mention of the need for younger members, which I think we all agree with. The hard part for younger people is they don't have as much free time as those old geezers do. And then the thing would be, could the board be doing more in terms of helping the organization and the community? And so we are going to devote a session to that at the next meeting. And I will send you all a reminder to come with ideas, because sometimes it takes a while for things to pop up, especially for me. And one of the big things we want to focus on is getting the community more aware of what RiverStone does. And hopefully we can go to service groups and stuff and give a talk armed with a video that we could be showing. And then hopefully we're able to answer questions we get. Any questions, comments?
I think that's a great idea. Getting out to service organizations and stuff like that to let them know what this is all about.
Well, because most people have no clue.
They don't.
Jim.
I'd make some comments, Coach, that, governance convinced me to step into the chair role. And in part of tongue-in-cheek comment from Steve was, you're the youngest of the group. You're the youngest on this committee. I'm 6 months younger than Steve is. And we do need to deal with the age of the board. The senior members of the board are indeed senior. And I think, we talked about going on the speaking tour 10 years ago. I was in my infancy on the board. And I thought, geez, I don't know enough about this place to go out there and tell people. I can't even explain the financial statements yet. I don't know the aggregates yet. But I think those of us who have comfort doing it need to go out and communicate who we are, why it's important for this community. And it almost solves 2 things. I think you'll find in those groups, the young pups, the 50-somethings, who have the time and interest in serving, in doing something related to our clinical operations, the residency, the public health responsibilities, et cetera. So I think it's a great idea.
So you're suggesting that in the presentation, we encourage people to apply?
To tell us if they're interested in doing anything with RiverStone, learning more about it, whatever it is. You know, when I sent a letter to Belton, I was trying to learn ranching. I wasn't as busy as I had been in any of my healthcare jobs, any of my other roles. And Darlene saw an ad in the paper. So, you know, Michael would appreciate this. Why don't you get out of my hair a little bit more? You know, with RiverStone or something, you could help those people. And so I'm now 12 years in or 11 years in, something like that. It's, as I learn more and more about it, it's a good place to be involved. So,
Yeah, 10 years ago when I retired, I was looking through the paper and they were looking for volunteers. And I said, RiverStone, oh, I can do that. Got down here, discovered I had no clue. But it takes a while. Okay, Bob.
Unless there's some objection, I think when you were discussing nominations, I think you implied that you were asking for additional nominations and there were none. Maybe we should put that in the minutes, if that's okay with everybody.
Yeah.
good point, Brent. Yep.
Okay, Bob, you're up.
I brought along some help just in case you guys got.
Wait a minute, you only brought one.
It's on all day long, right? So it's a good opportunity. Well, John is
Pulling it up.
doing it up. Hopefully, this information is beneficial to you, not only in understanding the risks to this organization, but provides you with information that will help you in your businesses or in your personal life. Because when we're talking about cybersecurity, it is a concern everywhere. And I don't know that a day goes by that I don't hear about a story of a breach or some nefarious character accessing information that they shouldn't have access to. So we are taking this really seriously. I know the board takes this seriously. If you remember, John put this as an item on our strategy document, that this is something that's really important. Some of what we share is going to continue to drive that point home. And not only about us, but we're going to talk about some of the impacts with business partners. So go ahead and slip it forward. You know, just some graphics here. Some of them are a little bit old, but I think they really resonate. So 90% of healthcare organizations have been breached in the past 3 years. 41 million patient records have been accessed inappropriately. These are big numbers, and healthcare for a long time had enjoyed kind of being on the outside edge of this. Our data wasn't as rich as, say, the financial sector, but now they're finding that healthcare data is really, really valuable. This graph talks a little bit about what organizations are spending on their cybersecurity. And you'll see everything from, I have no idea what we're spending, which scares me a lot, to 42% of these organizations are spending between 11 and 15% of their budget on mitigating cyber risk. Point of reference, we're spending less than 1% of our budget on cyber abatement. So this one is probably the telltale. You can see the trend is not changing. We are not getting in front of it. It is not going away. And out here on 2028, they are projecting that cybercrime is going to cost the United States 13.82 trillion with a T dollars. These are big things. Okay, questions on that before we kind of move on? Just setting the stage here.
I've received 3 letters in the last year telling me my information was compromised.
Absolutely.
Yeah.
I'll bet that's true. You've got letters that say, hey, we're going to give you coverage with
Yeah.
the
yeah.
3 credit bureaus for 2 years because, oh, sorry.
You're-
And these aren't small organizations. In some cases, these are the best of the best that have
Like
been
Optum.
accessed. And I tell my team, it's not a matter of if, it's a matter of when. And it is our goal to at least mitigate that risk because it is coming. And you'll see in some of these slides, our adversaries are getting far more sophisticated. All right.
Just as a sideline, totally unrelated to healthcare, Marriott just paid $500 million fine for a breach of their system, of their loyalty system and their loyalty numbers. Just to give you an idea.
Who did?
Marriott. $500 million fine.
Yeah. Yeah.
Fine, that's the fine.
Yeah.
Plus all the
That
work
doesn't-
they're
that
gonna have to
doesn't-
do
that doesn't
and
include
from
the
that.
cost
Yep.
of-
In our world, it's even worse than that, right? The breaches for healthcare because they're HIPAA violations can come with horrendous penalties from the federal government. So, yeah, big dollars, not only in mitigation, but to your point, Steve, in fines and other compensation to make up for a breach happening. So I brought Ian Summers. I think you all got a chance to meet Ian before. He's our director of infrastructure and architecture. His team is materially responsible for implementing our strategies around cybersecurity. So he's going to share with you we've got data from some of our teams. I'm going to share with you a little bit about what that data means.
Morning, everyone. Right here is a shot from one of our systems. This is our email system. This is called a spam filter. And its primary purpose is to prevent unwanted emails from getting into our systems. The reason that's important is because email is one of the most commonly used methods of communication besides your cell phone, which also has your email on it. And it is used to not only communicate between other organizations, but inside your email, you'll generally have a contact list. So it is a very easy tool to use to gain entry into other people's systems through bad actors, and also allows people to get a bunch of other information from your compromised system to go attack other systems. So it's an incredibly low resource attempt to get high value dollars out of subjects. On this graph here, we're basically showing you in a month time frame how many emails we get. The blue line is how many were allowed. The red line is how many were blocked. And in a month, we blocked 45,000 emails. That's 45,000 attempts into the system where we said, for whatever reason, this email shouldn't enter without even looking at the email. Generally, these come from bad actors such as outside the United States, Russia, China, things like that. What we really want you to understand, though, is that because of email's use and its importance in communication with business, it is a primary attack vector. And again, we have hundreds of thousands of emails coming in every day. And that's a lot of information for an employee who's doing a lot of other tasks as well to kind of disseminate, hey, is this email valid? Does it come from someone I should trust? Should I respond back to what they're asking for? Attachments that get added. A lot of you guys might remember the Prince of Nigeria email scam. That's kind of the one that kicked all of this off. I'll give you $11 million if you send me $50. That stuff still happens all the time. And because of how much email is used, it's really difficult to stomp all of these out. So again, just another vector for bad actors to get in. We want to do the next slide. Did anyone have any questions, sorry, about email before we moved on?
The bottom part of the graph, 7 total threats, viruses detected.
Yeah, so out of the month here, this little section references those 7. These were PDFs. So these would be attachments that were sent in an email, and the scanning indicated that they were not what they appeared to be. Generally, people will try to hide things inside of an attachment because you'll open it not knowing what it is. And once you click on it, you've, in essence, authorized that attachment to do something to your computer. Some things will vary widely. And then based on your security stance, hopefully nothing happens. And that's what happened here. They weren't even delivered. They were blocked and removed before they got to the end user, which is what we want to happen.
Do you guys, do you have a sort of a training? Once again, another board, they have actually a training, not only for the staff and that, but for the board members. And then I get tested several times a year, because what happens with email, you're going through it, you look at it, and we're referring, you click on it. That's what the reality is that you don't take the time to read the sender. And so that technical support or IT, and if I get caught not opening it up, it goes back. And if I do it twice, I have to go back to class to go to do it. So it's made me intimately more aware of what's going on. And so just
That's a good suggestion, actually. I'm not sure that we include your board members on that.
you should, because we send documents to you, and of course.
We do for our employees, though. That's a product called Know Before, and we I think our most successful one was Black Friday. We sent out a campaign trying to get people to click on sale items, and it works exactly as you said. If they fail enough times, they get sent back to training, or their manager's informed, hey, we have someone that's a little click happy.
Everybody wants cheap sunglasses, just.
And the number of staff, staff are so well trained, the number of staff that will share, send me an email or a Teams message because they got a text message from me asking for a gift card or asking them to go get some Bitcoin or whatever that is, they question everything. I said, well, I will never text you individually and sign it with my full name.
The board, to me, the board should be, you got to think of us as part of the organization.
And
So
you have a Best Western email address, right? You're in
I
their
have two,
domain,
yeah.
right? And so that's what we do. We train our staff and folks that are within our domain because they're within our system.
Right.
Right. But you have a good point. We should share with our external partners.
That's excellent point. And that's also some of the importance of branding as well. That helps people. If someone is trying to get you to click on a link, for instance, and do something incorrectly, if it doesn't say RiverStone Health on the back, that should be also another visual cue. So we do try as best as possible to mitigate people who are working quickly and fast that, tend to be click happy, as we call it. So yeah, this is email. Again, just kind of a glimpse into one of the avenues that people have to infiltrate our systems. John, if you would join.
I'm sorry.
No worries. So this is another application that we use. This one primarily deals with our physical devices. So this laptop that I have here, our servers, and other important mission critical equipment. The bars represent a collection of events that happened on that day. You can't quite see it because it's a very long list, but here on this left-hand side would be the types of things we're looking for. A lot of this would include things called malware. Those are programs that are meant to do bad things to your system. Potentially unwanted applications. Also, again, things that you don't want being executed on your system. You might notice the giant bar here in September. What that indicates is another thing that we look for, which is devices connecting to our devices that we control. This would be like a USB drive where data could potentially be put on the USB drive and walked out the door, for instance, would be something we'd be concerned about. When we investigated this one, it actually ended up being one user who had some skull candy earbuds that are Bluetooth. And every time they would walk around the building with those on, it would ask each computer, can I connect? And that got logged every single time. And I think we had about 5,000 instances of this person walking around that day. But I mean, those are the type of things that have to be considered when we're doing the organization. What is allowed? Like, right, that takes time and research to determine, is this actually a threat that we should go investigate? And so should we just remove that as a capability? Pros and cons on both sides. The other reason this slide is important is because this is a vendor that we've contracted with called Sophos. They provide, it's called a Security Operations Center, or SOC. And the reason they're such a good partner for us is they are a 24/7, 365 service. A lot of times here at evening clinic, 7 p.m. we're done. People go home. They tend to do other things, right? On Christmas, 2 a.m. in the morning. These people are allowed to come into our systems if they perceive a threat and turn it off immediately. And then they alert us, usually me via a phone call, an email, another form of communication. That is critically important when you have a small staff that only has a certain amount of hours where they're really on the clock. We've had, I think, 2 years ago, we actually had something happen on a Saturday, and this worked out wonderfully. And getting ahead of the situation and mitigating any of the damage that could have potentially happened. If you don't know that it's happening, this has happened a lot. I think telecom companies just recently announced that they were breached. If you don't know that you're being breached or even being attempted, then you're unable to take action to protect client's data or your own data. All in all, though, this graph is relatively a good indication that the Security Operations Center is working for the devices that have this program on there. So it's a great partnership, good expertise.
All right, yeah, so I know y'all love shared learning stories, and the one today is more about not only do we have to look out for ourselves, we have to look out for our business associates because they are being targeted, and in some cases they're really diligent in mitigating cyber risk. In other cases, not so much. And so we're extremely watchful. The shared learning comes from a business associate of ours that sent an email and it was compromised. So their organization had been accessed from an outside entity that was nefarious. They had no idea. And it happened that these nefarious critters then access assets within the company. So they got a list of emails that this organization did business with. And we happened to be one of their business associates. And so they made an email, looked like it came from this organization. It looked really good. Came in, it was a name that we knew. We did business with them all the time. One of our staff opens it, says, hey, it's coming from down the street. I'm going to pop this open. It says, hey, we need to have you enter your network credentials to access this information. And our employee got trapped. So our employee entered in their credentials, which again, we're training all the time, but they get caught because it's someone we know. We've seen these emails all the time. We had no idea. And so the cyber criminals were able to get those credentials and immediately started to try to access our network. And to Ian's point, our Secure Operations Center caught the first attempts and said, this is coming from offshore. This looks like it is nefarious. We're going to shut this down. And so they shut it down and they called Ian and said, look, we're seeing traffic coming into the network that does not look like it's legitimate traffic. And as we looked at it, we could tell that it was offshore resources trying to access our data. So what did we do about it? Well, firstly, we verified that they didn't get any access to our data. Secondly, we immediately implemented, we've always had some multi-factor authentication, but we strengthened that. We said, we don't care who you are, even if you're one of our employees and you go to London, we're going to force you to do MFA if you're going to access any of our assets. So even if it's our good guys, we're going to check you out. And we implemented that, and immediately we were able to shut down the attempts because these cyber criminals couldn't get past the multi-factor authentication. And then we gave the employees some additional training. We talked to them about what it was, what to look for, that you never respond to an email with your credentials. And then we elevated some of the security requirements for those individuals, right? We don't want to punish our individuals, but we have to drive home that they need to have a keen awareness of what kinds of things are malicious and what kinds of things are legitimate. And then we had resolution over just a few days, but this is ongoing. And I'm sure you've seen similar things to like this in your home emails, right? The other day I got a call from my wife. She says, hey, did you order me a new iPhone? Because eBay and PayPal say they've been compromised. I said, well, two things. I said, do you have an eBay account? And she goes, well, no. I said, do you have a PayPal account? No. I said, then it's probably not a big deal. But those are the things they want you to be afraid. So you click something. John and I were talking about, packages this time of year. And one of the favorites is a text that says, hey, we can't deliver your package. If you could just click this link, we'll get that straightened out and get your package right away. Well, what better time to do that than around the holidays? People are like, oh, I bet I could be getting a package and I should be clicking on this. So our cyber criminals are aware of that they're not just slouches. They are thinking all the time about the psychology of the individual and the types of things that are going to motivate a behavior that's going to put them in the driver's seat. So any questions on this? Big thing here is it's not just about what we do, it's also about what everybody else around us does. And I think, Steve, to your point about the board, we watch your stuff, but we could do more. All right.
So this is kind of this graphic here is to let you guys know what we have done in the past. You can see we started off red is bad in this instance. Those would be critical risk that were identified when we did this particular internal audit. This is an audit for our security that deals with policies and procedures, how our security posture is, do we provide training to employees, things like that. On the left-hand side, you can see the list of what we've accomplished so far. So we're currently up here. So we have a lot of green, no more red, and we have some blue, which I'll address in a moment. Blue stands for risks that have been identified but not yet taken care of. We have worked really hard on replacing some of our equipment. So we have what's called a hardware refresh cycle now going so that we can have a planned known need budget for these type of devices so that we can keep current with the changes that happen. Policies and procedures, huge importance, of course, right? This is how we explain to employees how they should be doing things and a way of being able to hold them accountable for their actions, as well as making sure that we are doing the right things when we are preparing our organization for security. We have the other thing that's really important here to know is that third parties are becoming increasingly more important. When it comes to that, you need expertise, right? Otherwise, you're not really doing, you think you're doing something, but you're actually not really doing it. So expertise is important, and that expertise is hard to find in individuals because of how much the stuff crosses over between either other companies and what they're doing, or just other vendors amongst themselves. So having a third party that has dedicated resources is becoming more critical as we move forward, especially with the speed at which technology changes. Governance also huge importance. That is how we kind of set standards, which will also be critically important. Again, talking about the earbuds, if everyone's able to bring whatever they want to campus and use their computers however they want, it's a lot harder to reduce risk than if we have some baseline standards and security measures that everybody has to adhere to and that you don't deviate from. That's how you set some of these quality controls. And then out of that report, we still have some high risk terrain. This would be the blue section. What's critical here to understand is there's a term in technology called end of life. What that means is the vendor, for whatever reason, has decided that that product is no longer supported, which means you're not going to get critical updates like security patching to them. When that happens, we have to replace them or stop using them. Those are our two requirements. We don't have any other choice. And that requires a resource commitment as well as a diligence to go out and find these end-of-life products and figure out what the replacement's going to be and how it's going to work in our organization. Because the vendor is going to make changes that may not coincide with what we're doing currently in our environment. So then we either need to find a new product or we need to update our particular workflow. All of that, of course, takes time and resources to do. It's critically important that it be done. But you can see here that as we have identified, so we do a risk assessment, we identify things that are going end of life, they go on the prioritization list, and then we get it done. These are the things that are outstanding. Some of these are entire software solutions. We'll need to address those, and we have a plan to do that. You just need to be aware that these type of things will always be a part of the security cycle as well. Getting out the old stuff, bringing in the new stuff, and then training people on how to use it and how it interacts.
And I think the takeaway of this slide is just that we are working closely with Shanna to make sure that we are creating enough headspace for us to continue the evolution without creating significant financial strain. And that is difficult to do because a lot of what we're doing is expensive. So let's jump to the next one because I know we're about to get the hook. This is just Infotech is a consulting firm. They dabble in the info space, and they had a session I sat in on talking about what they saw as trends. AI is the big thing. Everything is about AI. And with technology comes great gains. What also comes are great threats. So I'm going to just quickly go through here and talk a little bit about that. I'm not going to dive into all of them, but AI avatars. This is kind of cool because if you are running a help desk, I can make it look like Ian is actually talking to the user and he can answer their questions. Or if we wanted to do a presentation, but John wasn't really there, we could build an avatar that would act like John and deliver a message. Really powerful thing. Unfortunately, deep fakes is a big thing. This is where people pretend they're you and they're not. You saw it with Taylor Swift over political support. You see it occasionally with other areas where people say, well, that's not me. And just this week, I read an article about high school kids that had deep fakes and they were taking badge pictures and using them to create illicit photos that they routed around. And these kids are in a difficult spot because they are trying to represent that is not them. So the technology that actually identifies deep fakes is a big deal. We have to be able to authenticate what's real and what's not. Quantum advantage. These aren't just supercomputers. These are massive computers that can crush through tons and tons of data. And they are specifically strong in science, where you need to look at reams and reams of data and draw conclusions, or really complex business uses. It's outstanding. What they'll be able to do is impressive. What comes with that is we need some sort of cryptography with it, because all of our old ways of encrypting data are just about to be broken, because these computers will break all of the encryption keys of everything we've been stashing for a really long time. So IT has to be diligent in putting new capabilities in place to protect that data. This is a little bit scary, because we always thought that 128-bit encryption was fantastic. Nobody's going to get through that. And well, yes, soon they will be able to. And then just a couple things around the AI. Big things are, one, instead of casting this wide net, like I'm going to ChatGPT and asking them everything I could think of in a day, we are targeting AI to solve specific business problems. It will be far more efficient, and the ROI will be improved because we're not just saying, oh, tell me something that I should look up. So that's coming. That's a big focus. And then with that is going to come the sovereignty, which says, I have to be able to control AI. I have to know who's using it, why they're using it, is my data protected, and is it for the legitimate reasons that we would want that data to be accessed. So these are all now. This is 2025. So you can see, to Ian's point, we have to have help to identify what the risks are, because if you're trying to do this in a small shop, it's going to get harder and harder. And the last thing I'll offer you is, as we said, we need to look at our business partners. Our business partners are also looking back. And so we are now receiving notices from some of our partners, including the state government, that we need to increase our cyber liability coverage to the level of 6 million. Right now, we're covered to 2 million, and it's very expensive. With that is going to come the cost of premiums. It also could come with, other organizations are saying you have to have certain certifications in order for you to be a business partner with us. Again, that comes with infrastructure updates and resource updates. So more to come, but I think the big thing is we appreciate the board's support in helping us get to where we need to go.
So Bob, great presentation. Unfortunately, we do not have time for questions.
But you can always catch me.
They don't more than willing to speak.
Yes, well, yes, do that. So before we go into executive session with Shannon, we need to acknowledge 3 people who this is their last meeting. Don Jones, who's finished his county appointment, and Giuliano, who's finished her city appointment, and is devoting herself to more business stuff that she started.
Chocolate.
And Leanne Melachar, who is asking to leave so she can take care of her husband and has been here a long time, done a ton of good, and was the outstanding board member last year. So Carrie has something for each of you.
And John has something to say as well.
Yeah. So while Carrie's passing those out, I want to talk about this pile of rocks here. And this is a cairn. And cairns aren't just a pile of rocks, just like RiverStone isn't just a pile of rocks. They're significant symbols of guidance and leadership, of stewardship and care, of memorial and legacy, and ritual recognition, commitment, and endurance. And thanks to ChatGPT, I pulled up a couple things about Karen. Karens recognize an individual's ability to offer direction, vision, and stability. They're often built as memorials and markers and represent the care and responsibility that someone has taken in safeguarding their communities and organizations' mission, value, and resources. They're a sign of cultural and generational legacy, symbols of connection and lasting impact. And they honor not only individual commitment, but respect and recognition, the tireless work for strategic direction, policy decisions, and growth. And each of you departing our board or changing roles within our board are more than deserving of this symbol of what it meant to have you serve on this board for many years, some over a decade, and provide that commitment, support, guidance, and leadership. So thank you. Thank you very much.
Okay, Shanna, you're up, and the rest of you are excused.